Hi, how's it going? My name is Dr. Sivasundaram. I'm an orthopedic sports medicine, shoulder, hip, and knee specialist, and I'm here to talk to you today about a really common question I get in the office for the treatment of shoulder arthritis. Patients often ask, well, what's the difference, between an anatomic and a reverse total shoulder replacement? So just wanted to make this talk real quick to kind of go over the details, and we'll also talk about, what's new in shoulder replacement surgery. So for an anatomic shoulder replacement, we're essentially replacing the ball and the socket with metal and plastic parts. So if you look on the image on the left, that's a standard Gracie view of the shoulder, or an AP X-ray of the shoulder, as commonly known. And you can see that the shoulder is a ball and socket joint. And so with the standard shoulder replacement implant, we are resecting or cutting out the ball portion of the joint and replacing that with a metal ball, and then also removing the arthritic portion of the socket joint and placing a plastic spacer in there as well. So the right x-ray is an example of an anatomic shoulder replacement postoperative x-ray, where you see that the ball part of the joint has been replaced and now it's a metal ball. And you can't see the the plastic part of the socket joint on x-rays. However, the implant has a radiographic marker. So you can actually, if you look really, really closely, you can catch the metal marker that they put in the implant. And that helps me track the plastic component postoperatively if there's any complications such as implant subsidence. But this is a pretty standard anatomic shoulder replacement. By contrast, this is a reverse shoulder replacement. So on the left, again, I just for reference provided an x-ray of a normal shoulder where the shoulder is a ball and socket joint. And you can see that with the reverse shoulder prosthesis, the ball becomes the socket and the socket becomes the ball. And you may ask yourself, well, why would you want to, reverse the native anatomy? And the answer is because the reverse shoulder replacement is a really powerful implant for rotator cuff disease. And so the classic indication for a reverse shoulder replacement is if you have a massive and irreparable rotator cuff tear in the setting of arthritis, then you would use the reverse shoulder replacement implant. And so a big question that I often get in the office is, well, which implant is right for me? And that's probably something that I'll make another video for, because there's so many risk factors and things that we think about when we decide for patients which implant is best for them. But this is kind of the 50-yard view of the anatomic versus reverse shoulder replacement. And we can talk more in the office about which implant is best for you. Briefly, I'll discuss, what's new in shoulder arthroplasty. Well, a lot has changed in shoulder arthroplasty. It's still not as commonly utilized as hip and knee replacements, but the technology has really advanced quite a bit. We have now 3D preoperative planning tools, which I'll go into in more detail. We use patient-specific instrumentation, where essentially we make custom guides for each patient based on their specific anatomy. There is robotics that's being introduced closer to the end of this year for utilization in shoulder replacement surgery. A lot of my shoulder replacement surgeries are done in an outpatient basis as well. So, patients often ask me, well, I don't really, feel comfortable. I don't really want to stay in the hospital. And that's not necessarily the case. A lot of shoulder replacement can be done in an outpatient basis now with the advances in anesthesia and regional medicine. And so really that's kind of a discussion that we can have in the office of, whether people want to stay in a night in the hospital or whether they want to just go home the same day. From a pain perspective, we have a multimodal pain regimen where I work very closely with the anesthesiologist, where we use both narcotic and non-narcotic medication to make sure patients are comfortable. And there's a lot of improved instrumentation where really we can kind of help more patients with better instrumentation, whether that's augmentation on the glenoid side or longer lasting plastic for better wear patterns on the shoulder replacement component. So this is a example of a patient of mine where we're utilizing this augmented reality preoperative planning tool. So this is a CT scan of a patient where essentially preoperatively we can plan their implant size and components. And you can see we're dialing in the various sizes of the glenosphere on a reverse shoulder replacement implant. We can see, how much seating or fixation we're going to get on the implant. And really the whole purpose of this, when I go through this, I look at this for every patient that I do a shoulder replacement on, is to find the best components for them and also plan for any intraoperative surprises, so that's the really powerful thing with this new preoperative planning software that's out, is that really we can tailor each patient's anatomy to this shoulder replacement system, and it provides us a lot more reliability. And I found that my patients have been doing better with this preoperative planning instrumentation. So this is another view of this preoperative planning software, where here we're looking at dynamic motion of the implant. So not only does the preoperative planning software provide us static images, we can also dynamically look at the implant to see if there's going to be any component impingement or any problems. And again, the whole purpose of this system is to prevent intraoperative surprises. And so I really like the software because it allows me to really plan ahead for each patient, and both use the dynamic images and the static images to get a successful outcome. I'd like to thank you for viewing this video on anatomic versus reverse total shoulder replacements. My hope is that these talks in general give people a better understanding of what we discuss in the office, so it spurns more questions and more discussion, and ultimately more understanding for people. So thank you.